People go to the hospital for many different reasons, but one of the most common things seen in the ER and by neurologists are strokes. Strokes affect about 795,000 people in the US, and thinking about that in smaller numbers, about every 40 seconds someone has a stroke, and about every 3.5 minutes someone dies from a stroke. The signs and symptoms of a stroke are easier to remember once you've been told about them, and once someone gets to the hospital for medical attention, there are certain tests that they can do to find out what type of stroke the patient is having and decide on the best course of treatment for that patient. Knowing what to look for in the possibility of someone having a stroke is their best chance at a high survival rate and a low chance of deficits. The most common symptoms to look for are trouble speaking, slurred speech, facial drooping, paralysis or numbness on one side of the body, problems with vision such as blurred vision or complete darkness in some cases. The best acronym to remember for a stroke is BFAST, which stands for balance, eyes, face, arms, speech, and time. Even though all the strokes have basically the same symptoms, there are multiple types of strokes that a patient could be having. There's a thrombotic stroke, which is also known as a TIA or a mini stroke, which is typically a precursor that a larger stroke could be coming in the future. In a TIA, a blood clot forms in the brain and blocks blood flow, causing some brain cells to potentially die. With mini strokes, the symptoms typically only last between a couple minutes up to 24 hours, and they typically resolve themselves. However, it is still important for the patient to get to the hospital and be evaluated. Another type of stroke is an embolic stroke. In an embolic stroke, a blood clot forms elsewhere in the body and travels up to the brain and lodges itself in a blood vessel. TIAs and embolic strokes are both different types of ischemic strokes. Another type of stroke is a hemorrhagic stroke, which is bleeding in the brain, which causes the brain to be compressed by all the fluid that's in there, and the brain can't get the oxygen that it needs, also causing brain cells to die. Depending on the severity and the type of stroke will greatly impact the type of treatment that the patient is going to require when they get to the hospital. When the patient first gets to the hospital, they will get an MRI and a CT scan to decipher what type of stroke the patient is having and help the doctors plan what the best course of treatment would be from there. If the patient is having an ischemic stroke, they could be given the drug called TPA. It's known as the clot busting drug. If they can receive this medication, it is given through an IV to just help break the clot down and restore blood flow back to that part of the brain. It is typically the most beneficial if given between 3 to 4.5 hours from when the symptoms first began. However, if the clot is too large or it's been too long since the symptoms began, the doctor might also opt for surgery, which they will take the patient and insert a catheter through an artery in the groin up to the brain and manually dislodge the clot to restore blood flow. If the patient is having a hemorrhagic stroke, they will have to have surgery to have drains placed inside their brain to get the blood off. And if the brain is still continuing to swell after the drains have been placed and there's not enough room in the skull, the doctor might also recommend removing the bone flap, which is just removing part of the skull to allow more room for the brain to continue to swell without causing more harm to the brain tissue. If the patient survives a stroke, and depending on the severity of the stroke, they could have up to months of rehabilitative therapy to attempt to get back to the person that they were before the stroke. but every stroke is different, every case is different. Sometimes people can't get back to what they were before. Many families will be impacted by a stroke at some point in their lives, and knowing the signs and symptoms gives everyone around you the chance of success in case of a medical emergency. Just knowing the acronym BFAST could save someone's life off the street or one of your close family members. Strokes don't care how old you are, what race you are, how healthy you could be. Everyone is at risk of having a stroke at some point in their life.